Good afternoon, all of you.
Good afternoon, sir.
Good afternoon. Good
Good
afternoon.
afternoon, everyone.
Yeah, good afternoon. Good afternoon.
Good afternoon,
Srinivasan
sir.
sir, namaskar.
Namaskar,
Namaskar.
namaskar ji.
Good afternoon, all.
Yeah, good afternoon.
Good afternoon, sir. Good afternoon.
Tingarolu sir, namaskar. Sarin sahab.
Good evening, Satish Agarwal, Devendra Sarin, all the people.
Yogesh bhai, good
Yeah,
afternoon. Srinivasan sir, good
Good afternoon, good
afternoon.
afternoon, good afternoon.
Good afternoon, sir. Satish bhai, good afternoon. Satish Agarwal ji. Arakala ji, good afternoon.
Good afternoon, everyone.
Good
yeah.
afternoon.
Good afternoon, Madhushri madam. Good
Good
afternoon.
afternoon, doctor.
मधुश्री मैडम कहीं और सी बीच पे घूम रहे हैं.
हाँ सर, बीच में घूम रहे. बहुत गर्मी है ना, यहाँ पे 9 डिग्री चल रहा है.
सुषमा बहन नमस्ते.
Sushma Desai madam,
नमस्कार,
good
सुषमा मैडम.
afternoon.
Sir, very good evening. Very good evening to all of
Ajay,
you.
Good
Ajay bhai,
afternoon,
good
madam.
afternoon.
Good afternoon.
Arakala ji, good afternoon.
Good afternoon, sir.
Ajay Arora ji,
Namaskaram.
good afternoon.
Good afternoon, namaskar to everybody.
नमस्कार, नमस्कार.
Good afternoon,
Sir,
sir.
sir,
Everyone, good
sir.
afternoon.
Hello, sir. Hello,
Sir.
hello.
Oh, hello, hello, hello.
How are you, sir?
केशवलू सर नाम चेंज
Hello,
कर
sir.
दो.
Devendra Sarin, sir.
Sir,
Happy
sir,
New Year.
sir, sir.
Happy New Year.
Namaskar, namaskar. Happy New
केशवलू
Year,
सर
sir.
केशवलू सर
Singaru
नाम
Sir,
चेंज
sir,
कर
good
दो.
afternoon.
Yogesh, sir. Happy New Year. Good evening.
हैप्पी न्यू ईयर, हैप्पी न्यू ईयर.
Happy New Year. Congratulations, Keshav, sir.
Thank you,
Yeah.
sir.
Thank you, sir.
Yes,
Bhaskar,
sir.
sir.
Bunch of congratulations. Bunch of congratulations, sir.
Thank you. Thank you, sir.
Yogesh bhai, how are you?
मैडम फाइन. All good.
Madhushri madam.
हाँ, नमस्कार, मैडम. How
Sir,
are you?
Srinivasan, sir.
Good
Thank
afternoon,
you.
good
Good
afternoon.
afternoon.
Madam, you
Good
are
afternoon.
glowing with the knowledge and
Oh,
perfection.
thank you so much.
Yeah, really, you are glowing. God bless you. See?
Thank you so much,
Good
ma'am.
afternoon to all of you, sir.
Good afternoon,
Tingarvelu
Good
sir,
afternoon.
good afternoon.
Sukanta sir,
Madam,
good
good afternoon.
afternoon.
Sushma ma'am.
Good afternoon.
Good
Sukanta
afternoon,
Good
bhai.
afternoon, sir.
Happy New Year,
Only-
Sangavallu sir, and
Only one
Thank you,
everyone.
sir.
sir.
Thank you.
Sugandha
Same to you,
Chatterjee,
Ajay
good
ji.
afternoon.
Next week we will
Happy
be
New
there.
Year
Good
to all.
afternoon.
नमस्कार सर. चटर्जी सर, नमस्कार.
Namaste, namaste.
नमस्कार.
Namaste, sir. All of you, good afternoon, sir.
मेरे दवा
Sukanta sir, good afternoon.
Good afternoon.
Sukanta ji, how are you, sir?
Fine, fine.
Nice, sir. Nice. We're looking forward to see you there.
So good afternoon,
Singaru.
Yes, yes, yes.
We are
Good
all
afternoon.
waiting
Congratulations.
for you
Congratulations, sir.
via
Thank you,
Kolkata.
thank you.
Yes, sir.
Yes, sir. Good afternoon, Balram, sir. Good afternoon.
Good afternoon, everyone.
Good afternoon, Prashant.
Hey, Prashant. Good afternoon, Prashant. Happy New Year.
Good afternoon. Happy New Year. Good afternoon, Dr. Joyali, Rijvi, Madam.
सुकांता भाई कैसे हैं आप?
अच्छा
Yeah,
है.
good afternoon. I'm here only.
Yes, yes.
Sorry.
नवीन पाल को नवीन को बोल देना, फोन उठा नहीं रहे हो डॉक्टर साहब. मैं इस पे मीटिंग में हूँ. ये लग
Good
गया.
afternoon, Satish, sir. Satish Agarwal, sir. Good afternoon.
Good afternoon, good evening to all. Happy New Year to all.
Yeah.
Happy New Year.
Good afternoon, President Madam Neelam.
Jalil. Good afternoon.
Good afternoon.
Good afternoon, Nilaman.
Good afternoon.
Good afternoon. కాకపోతే
మిషన్ను ముగించడం 25 ఏళ్ల ఐఏఎస్ చరిత్రలో ఇదే తొలిసారి అని తెలుస్తుంది. ఈ నెలలో 2 సార్లు అంతర్జాతీయ ఐఏఎస్తో స్పేస్ వాక్ నిర్వహించాలని నాసా ప్రణాళిక రూపొందించింది. ఈ నెల 8, 15 తేదీలో స్పేస్ వాక్ నిర్వహిస్తారు.
తీసుకొచ్చి రేపు అప్లోడ్ చేయండి. మేము బాగానే ఉందని చెప్పు. రైట్ సార్. తిన్నదా వాడు వాంతులు కేసు ఎట్లా ఇంకా అరుస్తుంది.
Vishnumohan, good afternoon.
Good afternoon, Dr. Sukanta, Dr. Jaiswal from Patna, AK Jaiswal.
Good afternoon.
Very good afternoon, sir.
Good afternoon, Suganti. Surajji, good afternoon.
Good afternoon.
Good afternoon. Good afternoon. Good afternoon.
Good afternoon, Josh.
Yeah, good afternoon. Good
Yes,
afternoon.
good afternoon, Dr. Josh.
Yeah.
Good afternoon, sir.
Ajara sir, good afternoon.
Vishwanathan, good afternoon.
Good afternoon, sir. Good afternoon, Dr.
Preeti
Vishwanathan.
Girali, good afternoon.
Preeti, good afternoon.
Sumati,
Good afternoon.
Sunita Naik.
Preeti and Sumita.
Sumita, good afternoon.
Good afternoon, good afternoon, sir. Good afternoon, sir.
Good
Vishnu
afternoon.
Mohan, good afternoon.
Very good afternoon, sir. Good afternoon, madam. Ruchira, madam.
Ruchira madam, good afternoon.
Hi, good afternoon, sir.
Team Devyam.
Good afternoon.
Good afternoon, Ruchira, madam.
Good afternoon, sir.
Good afternoon,
Ruchira madam.
Ruchira.
All of you, HSC, good afternoon.
Ruchira.
Ekdam badhiya.
Sandeep
Ab
bhai,
kaise
good
ho?
afternoon.
Good afternoon,
Sandeep
Dr.
Trivedi.
Ruchira.
Good afternoon, sir.
So his
Good
infidelity
afternoon,
was
sir.
persistent and which was slightly
Singaravalu sir, good afternoon.
Yeah, good afternoon, good afternoon.
Good afternoon, Singarabalu, sir.
Yes, madam.
Good afternoon,
Good
madam.
Vishwanath,
Ruchira,
good
madam.
afternoon.
Good
afternoon. Ma'am, Smita, ma'am, good afternoon.
Dr. Nagendra.
Preeti,
Good
madam, good afternoon.
Good afternoon, Singaravelu, sir.
Sir, good afternoon.
Madhushri, madam.
Yeah, good afternoon, Preeti. How are you?
Fine.
Ajay Arora, sir,
Sunita,
good
madam,
afternoon.
good afternoon.
Good
Sir,
afternoon,
good afternoon,
Manoj
sir.
Balram.
Sorry,
Good
sir.
afternoon,
Geeta Patil, madam.
Sumita.
Good
Good
afternoon,
afternoon,
Josh.
good afternoon.
Good afternoon. Good afternoon. Good
Madam, good
afternoon.
afternoon.
Kiran, madam, good afternoon,
Good
madam.
afternoon. Good
Good
afternoon.
afternoon.
Ida
Good afternoon,
Nagural.
good afternoon, madam.
Good
Good
afternoon.
afternoon. Good afternoon.
Good afternoon. Good afternoon, sir. Good afternoon, ma'am.
Yogesh ji, good afternoon.
Yeah, good
Hi,
afternoon.
Kiran,
Ruchira.
madam, good afternoon.
Kiran madam.
Hi,
Good
Ruchira.
Afternoon,
Neela,
Yogesh
madam,
ji,
good
good afternoon.
Good afternoon.
Good
Good
afternoon,
afternoon.
Sukanta sir, namaskar.
Good afternoon, madam. President, madam.
Aditya,
President, madam, good afternoon.
Just arranging.
Good
Namaskar,
afternoon,
Neelam
madam.
madam. Good
Good
afternoon.
afternoon,
Hi,
madam.
Neelam.
Madam.
Thank you. What
Good
minute I
afternoon.
need to put this into.
Dr. Neelam, good afternoon, Dr. Neelam.
Dr.
Yes.
Geeta Patil, madam, good afternoon.
Good afternoon, sir.
Good afternoon, President. Good afternoon,
Thank you so much for all of you.
Good afternoon, President. Good afternoon, President. Neela, madam.
Good
Good
afternoon,
afternoon,
Dr. Neelam,
Good
Dr.
afternoon,
Singravelu.
sir.
है तो ये बढ़िया वाला
Good
है।
afternoon,
Good
sir.
afternoon, Neelam madam. Good afternoon.
Anurag,
That's
good afternoon, Anurag.
Good afternoon, Amar.
Janani.
Sir, good afternoon.
Balsavanaram,
Neelam
sir.
ma'am,
Good
good afternoon.
afternoon.
Devender sir. Yes,
Good
sir.
afternoon,
Good
good
afternoon.
Satish
afternoon.
Tiwari ji, good afternoon.
Ajay ji, good afternoon. Anurag, good
sir.
afternoon.
Good afternoon. Sir, good afternoon.
Sarin sir, madam, Neelam madam, good afternoon.
Good
Geeta
afternoon,
Patil,
sir.
madam, good afternoon.
Good afternoon, sir.
Good afternoon, madam. President, madam. Secretary, madam.
Gulati sir, good afternoon. Harmesh sir, good
Ruchira ji,
afternoon.
good afternoon.
Good afternoon, sir. Good afternoon.
So many.
Smita madam, good afternoon.
Good afternoon, sir. Good afternoon, sir.
Hi, Sumita, madam.
Ruchira ji,
Good afternoon,
Rajendra.
sir.
Rajendra, good
Satish Tiwari
afternoon.
sir, good afternoon.
Good
Rajendra.
afternoon. Very good afternoon, sir. Very good afternoon.
Sandesh, good afternoon, everyone.
Yes, sir.
Good morning. Joe,
Is it
sir.
morning?
Good afternoon.
Good afternoon. Good afternoon. Good
Kishore,
afternoon.
sir. Good afternoon.
Good afternoon.
You are traveling, I think.
Vishnu
Okay.
Mohan, good afternoon.
Good
Kishore
morning to
Bandore,
all of you.
good afternoon. Kishore
Good
ji,
afternoon,
good
sir.
afternoon.
How are you?
Good afternoon.
We are at
Dear
Dr.
Sonamani,
Prashant.
good afternoon.
Yes, sir.
Dr.
Good
Prashant, can I
afternoon.
request you to call up the chief guest if they've not joined? Dr. Prashant, are you there?
Yeah, I'm there, ma'am.
Okay, can you just call
Prashant,
up?
I am calling Shobna Gupta, madam. You call.
Ma'am has joined, ma'am has joined.
Okay, and has
Goyali ma'am has joined.
both have joined?
Yes, both have joined.
Okay, so it is exactly 2:30. Let us start.
Okay, welcome, madam.
Saji, let us start. Please make the YouTube open.
Good afternoon, Mahesh Mohite sir.
Namaste.
Saji, please
Good
mute
afternoon,
everybody.
sir.
Pramod
Good
John,
afternoon. Pramod
good
sir, good
afternoon.
afternoon.
Everybody should be muted except the names I've given you, Saji. Except those names, mute everybody else.
Yes, ma'am.
Dr. Saji, please involve Mayank. All will be muted except the names I gave you. And let me know when to start, when you've started the YouTube.
YouTube is live, ma'am.
Ruchiraji.
Yeah. Good afternoon, everyone. Respected President, IAP 2026, Dr. Neelam Mohan Madam, President-elect, Dr. Singaravelu sir, Past President, Dr. Vasant Khalatkar sir, our Vice Presidents, Dr. Arakala Bhaskar sir, Dr. Sareen sir, Dr. Sukanta sir, Dr. Sandeep Trivedi ji, and Dr. Jose sir, and our very dear treasurer, Dr. Alok Bhandari sir, and two very, very dynamic joint secretaries, Dr. Mohite sir and Dr. Anurag Agarwal, and all the dignitaries who are present over here on this virtual platform who have joined together for this special occasion. A very warm welcome to you all. A very good afternoon and a very, very happy new year to one and all. On the behalf of Indian Academy of Pediatrics, it is my great pleasure to extend a very warm welcome to our esteemed dignitaries, the senior respected academicians and dear colleagues, to the launch of 360-degree Pediatrics IAP practice guidelines and IAP digital platform, a flagship program of our this year IAP Presidential Action Plan 2026. This is happening under the visionary leadership of our President, Dr. Neelam Mohan Madam, who's going to share in detail about this program. This initiative definitely is representing a significant step forward in strengthening pediatric practice by uniting evidence-based guidelines with innovative digital solutions. We are deeply honored for this distinguished leadership from Neelam Mohan Madam, whose guidance is continuously inspiring us. It is again an honor and privilege to extend a warm welcome to our esteemed chief guests, Dr. Shobna Gupta, Deputy Commissioner in charge of Child Health and RBSK, Ministry of Health and Family Welfare, and Dr. Joya Rizvi Madam, Deputy Commissioner, Ministry of Health and Family Welfare, Government of India. Dear ma'am, we are deeply grateful for your gracious presence at the launch of 360-degree Pediatrics IAP practical guidelines and IAP digital platform under the Presidential Action Plan. Your leadership and unwavering commitment to child health at national level continues to inspire us and guide us, and our collective efforts towards strengthening pediatric care in India will be shown and reflected very soon. We are very truly honored to have you with us today on this momentous occasion, and we look forward for your valuable insights as we embark upon this transformative academic and digital journey. Thank you very much. Over to Neelam ma'am.
Thank you, Ruchira. And may I request Saji to be very alert and Mayank to be extremely alert that this launch should be without any disturbance. I would like to say good afternoon and warm greetings to everyone who is gathered here today on this digital platform. And I would acknowledge the presence of the chief guest, Dr. Shobna Gupta and Zoya Ali. All of us know the contribution of these two women in the healthcare infrastructure of India, where both of them are taking responsible positions as deputy position of deputy CM, in especially related to child health, and deputy commissioner in charge of the younger children, Dr. Shobna Gupta, and Zoya Ali is famous for her adolescent work. Besides that, I would like to acknowledge the presence of Dr. Singravelu, who's our president-elect, Dr. Vasant Kalaktar, our past president, all the 5 vice presidents who are my fist, which is Dr. Sukanda Chatterjee, Dr. Devender, Dr. Arakala Bhaskar, Dr. Jose, Dr. Sandeep, and all the EB members who have gathered here, all the executive board members, dignitaries, seniors, our secretary, treasurers, and joint secretaries. A warm welcome to everyone on this podium. To me, it gives immense satisfaction to stand or to sit before you all today with the thought that something which the moment I took over as the president-elect of Indian Academy of Pediatrics, a branch with more than 50,000 pediatricians across who have joined us, whether they are established members or the young postgraduates, it immediately took me to a nostalgic memory when I was training myself in UK. There was something that I felt which lacked in India, which I remember enjoying that even almost 3 decades back in my training. So, and that was the uniformity of the healthcare. So with that, I conceptualized this 360-degree pediatrics IAP practice quick reference guidelines, in which I thought if we can have all the specialties join us and something which, irrespective of where you are, whether you are in a tertiary care center or a tier 2 or a tier 1, a primary health care, we should have uniformity. It gives me pride and pleasure to say that the original concept was from a concept of Government of India, Niti Aayog and ICMR, and I was the co-chair of the standard workflow, which was created in several years back. And we wanted to have a uniformity of the healthcare, and all of us, the premium institutes, and I was blessed to be taken from the private institute where I was useful in making for diarrhea, for liver diseases. And similarly, we had AIMS, we had PGI, we had Lucknow, and the other centers who had come in and prepared those flows. And I knew how much efforts that were being made in coming out with a standard treatment workflow. So with that vision, I conceptualized this, that how we can address a day-to-day need for a clinical practice. So in the outpatients, if we have a very clear, concise, evidence-based guidelines, which are being provided by the experts in that field, all of us will not know everything about everything. But those experts are there who will read the whole information, make it a small guideline and SOP and provide it to us. That concept was from the UK, which I had gotten. So with that, the busy pediatricians across the country, because the workload of the pediatrician to the patient ratio is still not higher than what WHO standards would be. With that, these guidelines should definitely help them across the metro hospitals or the rural clinics, and they should be able to guide us. So we made 4 pillars out of this, and I approached first the pediatricians. I took with me Dr. Geeta, Dr. Prashant, Dr. Gaurav, Dr. Narmada, who were given the responsibility to connect to all the chapters. We know that we have several chapters. So almost 26 chapters who have been doing a lot of clinical work with them, and then we had chief editors, section editors, authors. So more than 300-400 people who were contributing to this, and they would be reviewed by experts, and then the section editors, and then the chief editors, and then these 4 were going to be the executive editors and the academic editors who are going to ensure that about plagiarism, AI, etc., and work on it. Then came the thought that what are we lacking more in this? Emergency was the first thing that came in my mind, that we do not have a structured guidelines how to practice in emergency. So I'm grateful I got in touch with Dr. Nitin Chawla, a young dynamic guy, and I said to him that I wanted the clear-cut guidelines on emergencies where I can involve the experts in that field. And emergency was one field which was just happening to develop and trying to be separate from the critical care. When I say emergency, as I said, these guidelines are not going to be talking about once the patient is admitted, the ward care or the PICU care and the NICU care. We are not talking about that. We are talking about all the specialties, OPD practice and the emergency practice that needs to be in that. I just realized I'm not pinned probably into that, and along with it, so Nitin was instrumental in getting Dr. Anil, Dr. Prerna, Dr. Indumati, all of them joined, and we're going to have almost 50 plus guidelines in emergency care for pediatricians and almost 200 plus guidelines for OPD practice day to day. Very simple in around 1,000 words with very simple infographics, simple algorithms. And how is it going to be different from the existing one? We created in some topics, we created a QR code where videos are being created, and in the same QR code, you go into it and you will be able to see the video. For example, in emergency, I have to teach about insertion of a pleural, putting catheter there. So these we will need some videos, and that's what we created. And then, of course, I realized that I can do nothing without the nursing care. So for the first time in India, we are going to have the pediatric emergency guidelines, and we're going to have the nursing guidelines, and it is the Presidential Action Plan, or TOT, with dissemination of this knowledge in the budget that has been created for social work to disseminate this knowledge to all the nursing care throughout the country. So it is not, the vision, the conceptualization was there by me, but it could not have been possible without the efforts of all those who joined me, all the specialities. I want to give my basic gratitude to you all for this in each specialty, whether vaccines, ID, cardiology, neurology, gastroenterology, endocrine, adolescent health, immunology, and so on. But having said that, when I met Dr. Vinod Paul, one of the things he had mentioned about the care beyond the nursery, he thought could be improvised. And therefore, we made hand on hand for the first time. IAP and NNF came together, and I'm grateful to Dr. Lallan. Both of us spoke about it actually in November 2024. when I got elected as the president and he got elected, both of us decided to join hands and to come out with guidelines. And these guidelines for neonatology also started, and I'm grateful for the chief editors, Dr. Sanjay Wazir, Vishnu, whom along with the NNF team, we are going to produce 100 plus guidelines, which are not for the NICU. They are for the care of the neonatology care beyond the NICU. So with that vision, as you can see, it was more than a year. It was 15 months of planning that went in the mind for it to be executed and giving this shape. Then came the thought, how should I give these guidelines to everyone? So with that vision, the action plan, I ensured that we collected enough funds so that we should be able to give these books free of cost to people, especially more than 50 years. The pediatricians love books, and I'm plus 52. So we like books. The youngsters are with apps. So we are going to give this free in app to youngsters, and all those who are above 50 and maybe above 45, those who want that, we will be able to give this guidelines book free. With that, we also ensured that a free vaccination book is being distributed to all pediatricians in Pedicon, and a free infectious disease and antibiotic book will be distributed free under the IAP action plan in the coming year, so that we are able to talk about Modi ji ki baat, who he talked in Man ki baat last visit. He talked about antibiotic surveillance. So antibiotics are being covered, and this project is also for the last 7 months it is going, but there was some issue in the execution, and this book will be given subsequently to that. So I wouldn't take much time, but I want to say I acknowledge the tremendous hard work of each author, each section editor, each chief editor, each core team who worked shoulder to shoulder, and it could not have been possible without the beautiful OB that I have, the president-elect, the past president, the EB members. You know, I am so very grateful to you all for having supported me in this vision of redefining it. Then the last thing was, how do we distribute? And I'm thought about having our IAP digital for ourselves. And I will talk more about it after hearing the wonderful vision of our chief guest. What are they expecting from us? And I would say that these guidelines will be with every pediatrician, either in the book form or in the app form. And the app which is being created is a dynamic app. It's not just an app where I go and put it. It's a dynamic app where the app is going to be for the pediatrician, for the parents. 2 dynamic apps are there. And also for the pediatrician, in this app, which is going to be launched today, is called the IAP Digi. All education free, even if 10,000 members are attending. We don't need Zooms and all. We will have, you just go on to the dashboard every day at a fixed time, fixed learning. Everything is going to be there, and we will have our own IAP Digi this year, which has been created by the grateful efforts of the OP, who stood shoulder to shoulder with me in these thoughts and worked hard to ensure that this is with everyone. With that, I request my President-elect Dr. Singaravelu, a man with wisdom and experience of academics and administration from South. May I request Dr. Singaravelu to introduce a beloved chief guest, one of our own, Dr. Shobna Gupta, whom I've met several times. Her humility, God has been kind to give her this post where she can be instrumental as the Deputy Commissioner to take care of children under the Ministry of Family, Health and Family Welfare. May I request you to introduce her before she gets on to her speech. Over to Dr. Singaravelu.
Thank you, our Visionary President 2026, Dr. Neela Mohanji. At the outset, wish you all a very, very happy New Year. I take this platform to thank you all, more than 160 person in the Zoom platform and more than 1,000 people in our YouTube. I thank the Almighty for giving me this opportunity to serve our organization as a president-elect this year 2026. And I acknowledge the presence of our Secretary, Ruchira ma'am, Treasurer, our Alokji, and all my 5 Vice President and Joint National Coordinators, and our past National President, and Uday Budhankar sir is there, and all other past our CAP delegates and great academicians and seniors. I really thank our visionary president who is bringing the second important launch today, the 360-degree IAP practical guidelines, which he has already done with the NNF neonatal guidelines on 1st of January. Hats off to you, ma'am, for your great initiative, and you are going to give a book to all our members, which is will be a ready reckoner on the table, because this it is being conceptualized, and she has given to great stalwart who made our IAP ke baad community ke saath. You all will be knowing how 2 years Geeta Patil ma'am did it, who is going to be the head of ours, along with our Prasad Karya and our Narmala, our own person is that Gaurav Gupta, and all the stalwarts who are involved, because each module will not exceed, topic will not exceed more than 1,000 words. That is the way the conceptual is, and it will be like a ready reckoner on the table for the practitioners who are sitting in the periphery, who cannot access into digital platform. Every time they can quickly go through the book once they come. Till then they can use the digital platform, and they can do a great service to the children of ours, so that we can reduce our under 5 NMR, what is IMR, what not. All this can be definitely is a very useful thing which our president has started. Hats off to you, ma'am, to be with you all. So with this, I am sure that Madam has explained everything about this. I don't want to go into depth of it. I really congratulate all the contributors and all the people who are involved in this module. Definitely, it is going to be a very useful program to the practicing pediatrician. Coming to my job assigned today, to introducing our chief guest. There are 2 chief guests. Really, both are equally very good. And the first person which I am going to introduce is our own pediatric fraternity. Madam Gupta ma'am is known, Shobhana Gupta ma'am, a person, a deputy commissioner of health and family welfare, and she is in charge of child health and RBSK program. But she is a down-to-earth pediatrician, which we all should know, because a person who has worked in the government, because I've been in the government service, as Madam told, for more than 35 years. People will know the ground reality. So a person who served in the government for more than 18 years and in a tertiary care center, who has taken care of newborn as well as pediatric, now sitting in the helm of affair of taking care of the entire country of children and newborn care. I'm happy that when I'm going to the CV, if I start talking about her, I'll be taking more than 15 minutes, which I don't want to do, because we want to hear her. But one important thing, she is a person who is involved in updating the IMNCA, FNBC, and everything, because I knew the value of IMNCA, because when IMNCA, which was introduced in 2005, I was one of the first participants from my own state, Tamil Nadu. 30 people were selected, and Kalavati Children Hospital, 1 week we underwent training. How it was very effective when I began as a state coordinator and my district coordinator, where I have trained thousands of our PSC medical officers, Anganwadi workers, and our VHMs. Madam has involved in bringing this revised guidelines and the FIMNCI and also newborn care. And not only that, she has formed guidelines for treating emergency pediatrics. And more importantly, she is involved in identifying birth defects. That is very, very important thing, which is very useful, because Nowadays, our NMR is coming down in Tamil Nadu and southern states. It is almost we are reaching single digit. It is all because of our IMNCA training, where there is no home delivery at all. Now, everywhere it has become institutional delivery. So, Madam is involved in that and updating in that, and birth defect, which is going to be one of the major problem where we have to concentrate in the antenatal identification, diagnosis, and she is in the helm of our in making the proper guidelines. Surely, with her guidance and RBSK, people will know the value of RBSK. How each and every peripheral area, school children being properly screened, and
Sir, we will
when
have
they are
to give
properly
time
reported, we
to
have to get.
Dr.
Yes, madam. Yes, madam. This is
apologies, we
important
should
one.
give them time to
Yes,
talk
I'm
about
done.
their vision. I want
Yeah,
them
yeah.
to talk, sir.
1 minute, the
Let's
last
talk
one.
with their
Okay, thank you. So she is involved in that. So RBSK is a very important program where our people should know she is involved. So with her support and guidance, which she is going to launch today, I'm sure this will be a very, very useful. Madam, welcome to you. And a small request as a person of OB, and we want you to get support to bring Child Health Ministry soon, where our president ourselves will come to you, where you want your help and guidance. With this, I'm happy to welcome you to this platform, madam. Over to you, ma'am. Thank you, ma'am. Thank you.
Can I request Dr. Shobna to please give a wisdom pulse? What is your thoughts? What are the areas you want us as pediatricians to work? So that is where we want to understand from you how to go about it in the coming year.
Yeah, sure. Thank you, dear President Dr. Neelam, Dr. Sangravellu, for such an elaborate introduction, and all the distinguished IAP members and my fellow pediatricians from the country. It's definitely my pleasure to be here amongst all and this important activity. And IAP is always being a cherished academic partner when it comes to formulating either technical guidelines or whether any government program or the campaign it goes. So definitely IAP always stands a very big chance. And being myself a member of the IAP for last 2 decades, I know what work is being done. Uh, Coming to the, as Dr. Neelam has, highlighted and others have also highlighted, India as a country is moving forward, and we have, big targets and targets and goals to fill. If we know sustainable development goals, the SDG goals we are having for the neonatal mortality rate, under 5 mortality rate, we have the timeline of 2030. And if we talk about the under 5 mortality rate, currently we stand at 29 per 1,000 live births, and we have to reach 25. And as we know that 2/3 of the mortality is still caused by your infant mortality, the under 1 year of age, that too by the newborns. So definitely it is very important to achieve that target as a country holistically. If we see the child and the newborn care in the country is, mixed. We have public health facility, which we are obviously, making guidelines and catering to, but still 30 to 40% of the healthcare belong to the private health facility also. More so, the situation varies in different states. If we see some of these states, the share of the deliveries, share of the newborn care, share of the child health care being happening in private health care is almost equivalent or more than the public health facility. So if definitely we want to achieve our goal as a country, all have to work together. It cannot be done in silos that only government is working and we are, implementing the uniform protocols in the public health. It has to go hand in hand. And definitely where this academy like this, the Indian Academy, where both the members, 50,000 members across the country belong to both of them. So that's why the role becomes really important in advocacy, in implementation at the ground level, and support to the government, especially when we talk about the areas, which are not easily accessible. If we see the demographic profile of the country, before going to that, I would just want to highlight about the mortality statistics, because many a times our clinician friends, they keep on working silos one-to-one on the children, and definitely the overall statistics which the country is required to, reach the developed country, or, the goal of Prime Minister, the Viksit Bharat 2047. it has to go hand in hand. So if we have a Tamil Nadu and Kerala which are less than 10, or Kerala having a neonatal mortality rate of 3.4, we have a countries like states like MPs and Assam which are above 30, 35. So definitely, when we say of the healthcare, equity is equally important. It has to be definitely quality and equity are two factors which need to be measured across. So definitely to reach that, the collaboration is the utmost importance. As a government initiative goes back to almost 2 decades back, where we started with National Health Mission, and lot of money, lot of funding was being given for establishment of the facility-based newborn care across the country, across the 3-tier structure of primary, secondary, catering to every till reaching till the block and the village level. More than 1.8 lakh Ayushman Arogya Mandir being present at the village level, being the lowest facility. Digital platforms like eSanjeevani being coming up, then pediatric critical care unit being sanctioned in during the COVID. The need was there, and almost 15,000 crore budget was given for establishment of these HDU and PICU for children in public health facility across the country. So a lot of funding is definitely going, and we are continuously working not to provide just the basic services with respect to the infrastructure, capacity building, logistics, but the updated equipment as per the recent technologies, as we have highlighted that in our SNCU, we gave almost whatever is being given is required till the level 2, the CPAP units, the HFNC, the blenders, with these all possibilities and logistics have been included in our government operational guidelines so that states can procure and they can update our existing critical care units. Mother newborn care units being coming up, and soon we will be coming up with our pediatric emergency ICU care guidelines also, and IMNCI. So these efforts are being happening across the country, but what we require definitely, we need to reach to those areas where accessibility of the HR is one of the major big issue. As we can see, when it comes, there's a rapid turnover. People don't want to stay at one job, and they don't want to stay in the remote area, even in the cities which are not so accessible. So definitely the IAP actually can support in reaching out to those areas, either defining that how the support can be provided, whether it is in the monitoring and evaluation, the capacity building of our existing health force, or to reaching out or committing to 1 or 2 days in a month where they can provide specialist services. We have a lot of camps happen at the village level, like at the Ayushman Arogya Manthan Shivir is there. We have the other campaigns keep on happening. So as a specialist cadre, actually that volunteership if can go from the academy side, where people can actually help provide the specialist services, provide the capacity building, or even help in the online or the we have the eSanjeevani platform, or help in the online advice. So those kind of things can be institutionalized so that we can reach the every corner and hook of the country. Apart from that, definitely what we require, just for the update of my fellow pediatricians, that right now as a country we have more than 1100 special newborn care units. So almost more than 90% districts are having 1 or 2 newborn care units. We have also a RBSK program, that is a Rashtriya Bal Swasthya Karyakram, where we have a continuum of care approach from 0 to 18 years of age. So there the children are being screened at the school by our mobile health team and at the Anganwadis twice a year, and in the schools once a year. And the children who are being identified with any health condition, the 4Ds, they are referred to the district early intervention center. In this endeavor also, when we referring the children, these children are sometimes they have identified with the conditions which have very specialized kind of treatment is required. There is a need of a psychologist, there is a need of a developmental pediatrician, they have a developmental delay. So especially the children with defects and the developmental delay, they need a long-term follow-up, and children with autism. So if you have a DEIC in your district and you can provide their therapeutic services, you can help in some way, then that would actually would help in strengthening our existing infrastructure and providing better services. Even the mentoring part can be there. So these GIC are actually, all the services are provided under one roof, where we have a certain essential HR being available under one roof, and these children can be managed with there is an audiologist, there is a speech therapist, there is a psychologist, and a pediatrician. However, sometimes there are gaps in the existence of the HR. People come, they get trained, and then they leave very frequently. So that problem can be easily filled by the mutual collaboration. Also in the quality, we say the quality initiative of these, we have an NQAS where we, certify and we see the quality standards that all the things are being required. So definitely there are already mentors from our pediatrician friends who are go as a Muskan facilitators, and they are a part of the quality initiative group. They go and they help in the certification. So probably those initiatives can be further enhanced, because quality is one thing we are looking at work. We want to strengthen our monitoring and evaluation framework to provide better quality, and the gaps are not similar across all the states, all the facilities. Definitely India is at a very the plateau kind of phase, where we have progressed a lot in the last 2 years. The progress is very good. If you see the mortality rates, almost 70% reduction in last 3 decades, which is even more than the global decline. However, all the facilities are not at the same level. There are very variations within the states, and within the state, if you see within the two districts, one district is doing very well and the other districts might be lagging behind. And many a times the reason for this, because the government gives funds equally to all the states and the districts. So many a times what makes a difference is a champion. There are champions in the government setup. There are champions which are helping out these people, and those places start doing better. So we have the identified, spots. We have the identified high burden states which need to be worked. So if that collaboration actually can help us to fill those gaps and challenges, and we can actually move forward with very good with these things. So
Thank you
with
so
these
much,
words, yeah.
Shobna. I apologize for the events. Dr. Zoya has just messaged me. She has to be in a meeting at 3:15 in the session in the ministry. So may I request Dr. Zoya, we will be introducing you, but since you requested, you have to be out in 6 minutes. May I request you to come over? Dr. Vasant Kalatkar shall introduce you in your absence, but at least we need a couple of words from you before you leave. Dr. Vasant, are you there?
Yeah. Don't worry.
Yeah, just she has to leave, so quick 2 lines on her, please.
Dr. Zoya is known to everybody. There is no introduction. That is a simple introduction from my side. That's we are always attached to her. And thank you, Dr. Zoya, for joining. I know it's a very short duration for you, and later on we will have a talk. But
Can we get
no
this?
issue.
So
Please
please give your
have
wisdom
your
first,
message.
and Dr.
Thank you.
Vasant will introduce you 10 minutes after you go.
No. Thank you so much. No, and due
Thank you, Dr.
apologies,
Zoya.
Shobna. Yeah. I'm so sorry, Dr. Shobna. We are this consultation for Sarva Shiksha Abhiyan. So the coordination with health will just start at 3:15. They have just informed me. So I just thought I'll speak very shortly. So thank you so much for having adolescent health also. But also, two things I just want to mention here is that along with adolescent health, being the kind of bridge between child and adult, it becomes a really very crucial thing, because whatever behaviors, whatever knowledge these young people have is very crucial for their development as an adult. And that is where each pediatrician becomes really very important for us, because young people do reach out to pediatricians, to your IAP members for help. So if we can have services which are adolescent friendly, first, that is it. If you can help us, because we have a national training group which does the training for all states. So if you can support us in trainings in these states or in duties, that is first. Second, also is I would request is that when we are updating a lot of our guidelines which are directly affecting the service provision to these young people in schools and out of school. So if we can have a continued partnership with IAP, whenever we reach out to you for supporting and giving us technical inputs and updating our guidelines, that should be there. Third, I would say also, since I look after the portfolio of nutrition, that is where pediatricians also become really important, because we are looking at a country which is still struggling with a huge load of malnutrition. Shobna is very well aware. We have been working with her in the creation of the guidelines for HbA1c, HbA1c. So that is there, but like a lot of times we need specialist inputs also, because these young children less than 5 who are severely acutely malnourished with medical complications, and now the government has also gone ahead and added moderately acute malnutrition. So it's a huge set of young children less than 5 who will need support from pediatricians, whether in private sector or in government sector. Within government, you must be aware about the nutrition rehabilitation center which we have. So there also we are looking at increasing skills of those medical officers who are posting there, because you do realize that we don't have pediatricians across all NRCs. So if we can have some partnership with the IAP in which they will help us in training the medical officers to give the best services possible at the nutrition rehabilitation centers, that would be really very nice. And last, I would say is not last, second last is that about breastfeeding. You all, of course, you're the ones who keep a big proponents of early and exclusive breastfeeding. If this can be something which is across board, means that every time you talk to a young, I would say, a infant, a newborn, a neonate, please continue stressing on early initiation and exclusive breastfeeding for 6 months, because that is where, as Shobna also mentioned about the SDG, we are signatory to a lot of SDG goals in which early initiation and exclusive breastfeeding becomes very essential. And that is what we say, the first vaccine of a child, that pediatricians will play a very big role in ensuring that every child who is born is fed within half an hour and exclusively fed for 6 months. And also, in case there's a problem with the mother, we do have the lactation management units as well as the CLMCs, the comprehensive lactation management centers. So either way, mother's milk is the best. That has to come very strongly from the IAP, I would say. And lastly, anemia. Anemia is a thing which we are struggling across all ages. So even though the anemia, we are looking at all ages, IAP can play a big role in ensuring that any adolescent, young child who comes, they're tested for anemia. If it is iron deficient, fantastic. Then you treat them according to the national guidelines, see that they're retested, and then they go back to the prophylactic dose. In case it is not iron deficiency, then you please ensure that the child is adequately tested and put on the correct regime or referred. So that linkage of managing anemia is something which is a big thing for us. And there's a huge push for the government to come up with a new strengthened AMB guideline, which we are working on. So we need all the hands on the deck. So everybody who's there, who's looking at young children who come in, please ensure that they are fully vaccinated. They are tested for iron, because we want children to give the 100% when they are in schools or Anganwadis. If they're performing to their fullest, if they're not anemic. Breastfeeding, we have talked. Good complementary feeding, we have to also say. And of course, to stop the use of, not stop, maybe limit the use of processed food. So it is something in which every IAP member can support the government, can support the government program, so that every child, whether in school, out of school, preschool, after crossing school, also has the right information to live a healthy life. So that's it from my side.
Zoya, I know you're leaving 30 seconds more to go.
Yes.
I will take both of you, because nutrition was something very close to me. So in the history, my main action plan is on nutrition. I plan skill training modules, and they're going to be 200 module across the country for pediatricians. So when I launch the nutrition, I would request both of you, and I love your message. You didn't think introduction is so long. That's the problem with pediatricians. They love speaking a lot. But I promise you, next time I call, nobody will speak. It's going to be ta-da and ta-da with both of you launching the nutrition module, where you will see what we are doing for the country in the nutrition. Thank you from the
Thank you
bottom
so
of
much.
our hearts and liver
Thank you.
to join us. And we will see you more in Pedicon and listen to the wisdom pearl of both Shopna and this. I am very pleased to say that both of them have agreed to be in the program in Pedicon, and I'm absolutely looking forward to be in those panels where you will give your wisdom pearls. Thank you so much, Shobna. Thank you so much. We will launch it through Shobna will launch the module. Thank you so much. And back to Dr. Vasant. You want to say a few more words about Zoya in her absence, that she's predominantly...
I think her speech, respected Dr. Neelam, President 2026, all the dignitaries, all Vice President, President-elect, Secretary, and those who are delegates. Good evening from all. Really, I wish you a Happy New Year. and I want to make it short. Already Zoya shown her what she is doing. There is no need of instructions. She is at Ministry of Health. That's the only thing. And she basically she want to join with us. That's a pediatric. That is her important recognition. That's what we want to say. Congratulations, Dr. Neelam. And see this program of NNF quick relief, this 360-degree. I really want to congratulate Dr. Neelam for something new. See, everything every year there is a new. It should get happen. And really, and we are having a app. Very good. That's a good thing. Very good app we are having last year. We are developed, and we can go through that app our all website so that it will reach to our 50,000 members which we made last year, completed last year, and now they are going to increase membership. So these all things will be there. And definitely our pediatricians are there to share. My request to all 50,000 members that don't keep it that as suna ban kar diya. You have to share all these things. Otherwise, whatsoever Dr. Neelam and her team is doing the Hercules task, it will be in the West. It should not happen. It's not for a Dr. Neelam, it's for a IAP. Everything she is doing. So keep in mind that always it's not a present bolta hai karke karna hai, but it should be from your heart, your mind, that whatsoever program is going on. Really, I'm thank you last year how you work a lot, all the members. Please, I request to you all, please do the work.
Thank you so much, Dr. Vasan. That is despite your.
Thank you, madam. See, Neelam, I was supposed to stop. No need to say thank you. I was supposed. I know the time limit. Don't
No,
worry.
not for
Thank
you.
you. Thank
I
you.
am just comparing. So I
Thank you.
request now Dr. Narmada and Dr. Geeta to show the launch of the module so that Dr. Shobna can do the launch of the two, the first module which you want to launch. Over to Narmada and Geeta, please.
Thank you so much, madam. It was a great pleasure and opportunity to work with you for the past 6 months on this 360-degree pediatrics. Every day, I know how much of time you had contributed. So I request Dr. Prashant to share the.
Yeah. So Saji, please share the presentation
Yeah.
in which we will be showing initially
Yes.
today's program
Yeah.
and a short crisp video of IAP 360-degree. Next slide, please, Shaji. This is the presentation plan 2026. Along with the executive chief. And these are the sections, allergy, adolescent, cardio community. On this section, is the day which will be launched. Today, Navda will be doing the work of
Today
launching.
we are.
Yeah.
Thank you. So we have the prestigious. We know allergy is coming up in a very big way compared to the infectious disease also. So can I go to the previous slides? So we have the allergy sections which will be released today, and the chief editor was Dr. Neeraj Gupta and Dr. Krishna Mohan, along with the section editors Soundarya Mahalingam and Soumya Nagaraj. They really put in a lot of work into this. I really congratulate all the authors who have done a tremendous work. And today, for the first, it will be on allergic rhinitis. We all know allergic rhinitis is less compared to that of the asthma, but it is really one of the greatest comorbidity in the symptoms. So our practicing pediatricians will have a bird's eye view on how to treat and manage in their practice. So this was the topic that was first selected. I deeply congratulate the team for having worked on it. Now I request Dr. Shobna Gupta to kindly inaugurate the first chapter on allergy.
Dr. Shobna, you'll have to say, you'll have to unmute yourself and say when the.
Yeah, I launched the 360-degree pediatrics.
Next slide, please. Thank you, Shobana ma'am. Thank you so much. Next slide. Next slide, please. For the next slide. Please share the.
Here the allergy thing, allergic rhinitis chapter.
Saji, please continue the presentation.
Shaji?
Madam, start that presentation.
Yeah. Yeah. Please continue. Yeah, this is the allergy section. This will be our page on 360. The logo designed by us under the auspices of Dr. Neelam Mohan. So we have the chief editors. Next slide, please. This is on allergic rhinitis. The unique concept about it is, next slide, please.
This is totally allergic rhinitis chapter. This will be there with the beautiful layout.
Yeah, next slide. So this is a basic thing as an infographics, very simple infographics given across all sections. So even in a busy OPD, just a quick referral, the infographics will give you the gist of what the topic is talking about on particular sections. Every authors and the editors have put in a lot of effort, and we had the team who designed it. Next slide, please. Next slide, please. Yeah, so this is the simple classification. Next. Yeah. The management approach has given in points wise, so they can easily do it, see it within a glance. Next slide. And the pharmacotherapy also given in a way that it is easily understandable in the table. We have kept the written concept to a very minimal, so no lot of notes on pathogenesis. Next slide. Yeah, this is the diagnostic algorithm. It will be there for most of the topics, giving a very clear bird's eye view on how to approach the problem. Next. So every chapter will have the key practice points and further reading if you want to really go into the chapter. And as Madam said, once the videos and app is ready, the QR code will also be put up here so that people who want to see the things in the videos can directly go to the QR code and read into the videos. Thank you so much. Thank you so much, ma'am. So
Thank you, Narmada. That was very crisp. May I request Geeta Patil to launch, to present the adolescent section, and in the absence of Joyaji, Shobna will release this too.
Thank you very much. Thank you very much, madam, for giving me opportunity. Start with the slides first. Yes, today's I think it is a great occasion for us to launch this. Already Zoya madam has explained to us, and it was a great experience from last 4-5 months. We had lot many brainstorming sessions to plan everything, and this is adolescent. Zoya madam has already explained. This is very focused platform to strengthen the adolescent centric perspective in the pediatric practice. This section is been edited. Chief editors are Dr. Swati Bhave madam, Dr. M.K.C. Nair, all of you know them. Section editor, Dr. Sushma Desai, Piyali Bhattacharya, Shamik Ghosh, and there are 19 topics. Yes, and these are the authors. All of them have taken so much efforts to make it as already Dr. Narmada has told how we are going to go more of a infographics, and the visual presentation will give you about the idea about the topic, and immediately you will get it in the office practice. So this is very important for us. And today we are going to launch the topic from the adolescent medicine. I'm very lucky Dr. Swati Bhave madam, who is the chief editor, is there.
Can I request Dr. Shobna to say, I launched the adolescent section?
And madam, I want you to join, madam. Dr. Neelam Mohan madam and Shobna madam, both together should launch our first topic. We'll be very lucky. Emotional and psychosocial aspects of growth and development.
We launched the adolescent section.
Congratulations.
Thank you, Dr. Shobana ma'am. It's a
Doctor, both of you, thank you very much. I think, Saji, can you start?
Yeah, you start.
Yes, and as the designing, the way it is done, the authors of this are Sushma Desai, Swati Ghate, and Amok Shahane. They have put a lot of effort. There are quite a lot of infographics are there, tables are there, and this is the basic topic which we should have. Everyone has to know about the emotional, psychosocial aspect of growth and development. We have got many other topics are going to be included. Just scroll up little more.
Slide, yeah.
This is a case based, and it is so easy to understand this topic. Little more scroll. So every case we have got some red flags, and from the early, mid, and late adolescent. Scroll little more, and at the end of little more scroll. I think beautiful designing is done. Very easy to read and grasp the topic. Scroll little more, little more. I think every topic will have a key messages and will have a suggested reading. So anybody wants to go forward to dwell in this topic will be easy for them. Thank you very much. And this is our plan of, and very lucky that we have launched this topic, which is a basis of adolescent medicine. Thank you very much.
Thank you so much, Geeta. And now it is indeed a pleasure for me to request Dr. Gaurav Gupta and Dr. Prashant because this was another thing that was in my mind, that getting this Zoom where everybody is not able to, sometime, in a Zoom, they're limited up to 500. I love the app in 2000 because I belong to that EB where you have to just go on a board and 365 days. I wanted only one link. I don't want every day to search for the link. So with that vision, I was planning that if I have a platform which is going to be called as IAP Digital, where 365 days, there should be one place where I should just go and see at what time of the day, fixed time. There are classes every day at 2:30 to 3:30, every day at 8:45 to 9:30, 10. We have to have a complete. So it gives me immense pleasure that the next launch of a program is going to be another unique thing. For the first time in IAP, we're going to have not only an IAP action plan, President's Action Plan, which is going to be, the TOTs, and this year, by the grace of Almighty, we have 700 plus workshops, but we are going to launch IAP Digital Action Plan Committee. And this committee is a surprise, which is going to be launched next. But where will they work? They need a platform. And that platform is going to be told by Gaurav. Why do you need a platform? And how do you get the platform? So over to Gaurav and Prashant.
Thank you, ma'am. Your vision is truly breathtaking and astounding. And I feel that the kind of uh, many changes that we are doing to the IAP is really, really praiseworthy. The digital platform is absolutely bang on the mark, especially because of what you have said. Before this, we had to scroll through each and every event to find out where it was happening. Now, with just one app, each and every activity, whether it is neonatology, emergency, 360-degree pediatrics, and everything else which ma'am is coming up in Pedicon and all the surprises, all of them will be available at the click of a button. So, without any further ado, I would like Prashant to come over and explain the app in further detail. Thank you, ma'am.
Thank you so much. And as we know, this is going to be a digital world. Saji, please launch our digital platform. And this platform is actually called as IAP DG app. So we welcome one and all IAP DG app. This app will have your user ID and passwords, which will be unique, registered with IAP. So to download app, we will be providing you with the Android and Apple, both the links. Once you download, enter your credentials. There will be a disclaimer page which will have all the details about the app. You have to accept that, the terms and conditions. Once you do that, all this three has to be ticked, and once this is ticked, you will be launched to IAP DG. And once you entered the user ID and password, this is, your login screen. A dashboard will be seen. Any live program of IAP which is happening will be seen as a live program. And along with that, you can see, n number of people can see that. Even the upcoming webinars will be visible as a dashboard. You can add that to calendars so that the reminder will be there in your app. Say, for example, this is a emotional, the adolescent part which we have released. If it is there, even you can bookmark the webinars. So the favorite webinars can be seen easily. Left side, there are plenty of menus in which you can share this with your friends who are IAP members. The live webinar section, you can see at present the IAP NNM webinar which was done is visible. During that webinar, you can ask the questions directly to the experts on this, and that will be sent to the experts. They will give you answers. There will be polls which can be answered from the website app. Upcoming sessions will be seen. The previous webinar sections can also be seen. If you have bookmarked or if you have saved it, that will be visible. If you have watched it, then that will be fine. Most important thing is a notification. I request everybody to allow notification so that the push notification of any programs which we are doing, that will be there. Even by the calendar view, you can see the number of programs done and can watch it. So that will be there. We have given a search option of a webinar that can be by a topic or tags or a keywords or a speaker name. Anything which you do will be there. If in advanced category, this all things are there, then you will be easily finding this. This webinars will be integrated with the AI, and you can share the apps. We will be giving you the links. All survey and polls which we want to conduct can be done through this. And most important, as I said, your watch history will be visible whenever you want to see it again. Most important feature which we have added in this app is in-app video feature. That means you are watching the video, but simultaneously you want to actually do some work or reply to someone else, then the in-video will happen and app video will play and you can see that. So this is with proud things. We present to you the IAP DGF, the Presidential Plan 2026. A download now, and we'll be providing you the link just now only. Thank you so much.
Yeah, you have to ask them to download, and even in the inauguration, we'll make everybody download the app. So all those who have joined, can you just tell them how to download? They need to go to the app. Can you tell them step by step? We can't hear you. Okay, so basically, you will have to go to the App Store and you look for IAP Digital and just log in. Whether you have Android or you have Apple, we can. I have to speak because Prashant is not audible, so I spoke on his behalf. Please go to the App Store and download IAP Digital app. And thank you so much for both of you. Can I request for the official thanks by Alok? But before that, if any past president has joined on the stage, can I request them for the comments in case Dr. Basav Raja or any other past president? I'm just trying to see if the past presidents have joined in the group. I would be very grateful if they can give some comments.
Balankar sir is there.
Thank you so much, madam. Our dynamic president, Dr. Neelam Mohanji, who has been a very, very great initiative in alignment with Digital India. That is the initiative which is started by our Honorable Prime Minister. So, madam is also moving in the same direction, and all the programs were excellent, and it has been started from the day one itself. Best wishes, madam. We are always there for any work which is being required and to be worked, madam. Thank you.
Thank you. I just wanted to say you missed today. We had Shopna ji and Zoya who came over on the stay and launched the 360-day pediatric practice guidelines. And thank you for all the support to everybody, all of you who've joined, all the vice presidents, very grateful to you for that, and the Ruchira and Alok for being my shoulder to shoulder, working along with Singravelu and Vasant Kalatkar. Over to Dr. Alok Bhandari.
Well, respected chief guests, Dr. Shobna Gupta and Dr. Zoya Ali, Deputy Commissioners in Ministry of Health and Family Welfare, Government of India, esteemed office bearers of the Indian Academy of Pediatrics, galaxy of past presidents of IAP, and eminent pediatricians all across India who are on this platform. On behalf of IAP, it is my proud privilege to propose the vote of thanks for this auspicious inauguration. 360 Degrees Pediatrics, IAP Practice Guidelines and IAP Digital Platform Program under IAP Presidential Action Plan of our visionary President, Dr. Neelam Mohan ma'am. And at the outset, I express a deep sense of gratitude to our chief guests, whose presence and inspiring words have truly enriched this program and set the perfect tone for today's deliberations. I sincerely thank our IAP national, state, local branch leadership and the entire committee of 360-degree team whose dedication, meticulous planning, and tireless efforts have made this program possible. Last but not the least, I thank everyone present here today for being a part of this historic event and for your continued commitment to the mission of the Indian Academy of Pediatrics to improve child health and have better childcare across our nations. With these words, I once again thank you one and all and wish the program a grand success. Thank you, please.
Before we end, I just want to take the opportunity to invite all of you all to Pedicon. We are waiting to give you more surprises. Please come to Pedicon 2026 in Kolkata. The scientific program, I'm very grateful. We've been planning since March 2025. All the suggestions which people have given, we've ensured that chapter wise, a speciality so that people are able, so the CMEs and all are very structured to all the messages that I got when I had put in some requests to the IAPians. There were more than 223 people who replied to my mail, which I asked them to suggest, and we try to incorporate as much as we can. It could not have been possible, but one of the highest number of faculties ever in the history, 1100 plus, with excluding the chairpersons too. So, and 54 international. So we have a state-of-the-art program, even in the Pedicon, and we await your presence to surprise you a little more. But all the thanks which he said, I just want to add one more to my beloved EBs, because you are the spokesperson of your state. Go above everything. Just work with your conscience and your heart. Stay away from politics. This year, dedicate yourself to truly raising the bars of IAP in academics, administrative, and social work. Thank you with that to Dr. Alok, Dr. Ruchira, Dr. Sigravelu, Dr. Vasan, Dr. Geeta, Dr. Narmada, Dr. Gaurav, and Prashant for sharing on this scene. And a big thanks and a big thank to the two who joined us today, Dr. Shobna and Zoya. Thank you once again for being in my life. Thank you.
Congratulations, Neelam.
Thank
Excellent launch, the C60 book and the app. Wish you all the best.
It is you predecessors who guided us, ma'am. Thank you. So with that, we call it a day today.
Well done, Dr. Neelam. Well done.
Thank you, sir.
Congratulations, Dr. Neelam ji.
Thank you so much, Dr. Yogesh ji.
Yeah. Best wishes,
First time
madam, for the great successful tenure.
Congratulations.
Thank you.
Congratulations, Dr. Neelam, madam. Thank you. Bye-bye.
Congrats, Dr. Neelam.
Congratulations.
Vardhan ji, namaskar.
Dr.
Congratulations,
madam.
Congratulations, madam.
Congratulations.